In an interview that was released Sunday, it was done Friday, President Biden said that it is morally wrong to prevent a child from undergoing gender transition surgeries.
In some states, I won't get into the politics of it, but in some states, it's outrageous, and I think it's immoral. The trans part's not immoral. What they're trying to do to trans persons is immoral.
Well, according to a recent Trafalgar poll, more than 78% of Americans and more than 53% of Democrats do not think this type of experimentation should be allowed on children. So, do 53% of Democrats know they stand in defiance of the leader of their party, that what they do is, or what they believe is immoral? Now, the UK's National Health Service, United Kingdom, appears to agree with the majority of American people, as it published last week plans to restrict the treatment of young people under the age of 18 who are questioning their gender, as we are seeing a growing pushback against this. Joining me now to discuss this is Dr. Quentin Van Meter. He's the president of the American College of Pediatricians. Dr. Van Meter, welcome back to the program.
Tony, good to see you. Thank you so much.
So it appears that the American citizens are more in line with the British government on this issue than they are their own government here in the United States.
Well, a number of states in this country are aligned with what Britain is doing nationally on its level of its government-run health program. It would be the equivalent of the CDC and the Department of Health and Human Services coming out with an edict saying that cease and desist any social, medical, and transition of gender-confused individuals. It's a phase that they're going through. They will most likely resolve this through the help of significant counseling efforts, and that all the things that have been done previously with social affirmation, something as simple as pronouns and name changes and whatnot, something as significantly medically important as blocking normal healthy puberty, and using the wrong sex hormones in children, and finally mutilating perfectly healthy normal organs, body organs, to try to create the appearance of the opposite sex. All of those things have been found to be not only beneficial to mental health over the long run, but in some cases actually detrimental to mental health. And if the whole purpose of doing these things is to improve the mental health of these individuals, it is not based on reality or science. So Britain says no, under no circumstance. Sweden says no, it's not going to happen unless we do it under a very carefully proposed research protocol, which is yet to be developed. Finland is right behind, and France is not far behind Finland, in saying that this is an emotional issue that needs to be dealt with counseling. So we are essentially, we have some very enlightened states in the United States that have come together with laws to protect children from this abusive circumstance.
So, Dr. Van Meter, I want to ask you this, based on, the UK is usually not, I mean, they're kind of, I don't want to be too broad and general in this statement, but they're usually a little more liberal than we see what's happening in Europe. So what's this decision based on? Is it based on evidence that they have accumulated thus far, or is it the absence of lengthy, long-term studies on the implications of the hormone-blocking treatments, puberty delaying, and these surgeries? So which is driving this decision?
It's actually both. So the lack of any long-term studies that prove safety is evident because there are none. There are none in the making. There are none. There are some that are talked about as if they were such kinds of proposals, but in reality, they're sort of a sham kind of a study through an NIH grant, which does not have any controlled. It's basically just observing the prospects of what goes on in the gender clinics and for gender clinics in the United States in particular. It's not designed to have a control group or even any generalized protocols that each institute follows as part of a very carefully constructed
Is that intentional? Is
yes,
that intentional?
it's totally intentional because they already want to essentially get the results they want. And the way they do it is by designing a study that collects things that they want to collect. not it's in total disregard to scientific method. And so the UK knows this, and on top of that, the UK has just based on their report is based on a very significant review of existing science that looks at whatever benefits have been claimed and whatever harms have been documented. And they have documented harms. There's no question about it. And having had this information so carefully done in a very valid way, the UK government said, I think we will cease and desist immediately.
So how should medical professionals be responding here in the United States based upon the fact that you've got these competing views, one based on evidence or lack thereof, and the other simply just really, it appears to be motivated more out of politics than anything else?
Well, I think, reason should should prevail. It's going to take a while, and I think we're going to have to chip away at some of these things sort of slowly but surely, but the wall is beginning to crumble. The bricks and mortar are not strong enough to resist the invasion of truth. And so we are going to see more and more courts kind of listening to the fact that, my gosh, an entire government in Europe, a very progressive nation in Europe, has evaluated this, and maybe we should use that study instead of the hopeful wishes of the gender activists in terms of setting what standards should be, followed here in the country, in the United States.
I think you're absolutely right. Look, science, and it's fascinating how those on the left are always promoting science when it says what they want it to say, but not supportive when it undermines their objective and goal.
There's a tendency to just dismiss things. Oh, that's a bad study, without explaining why it's a bad study. There is a beautiful, beautiful paper that just is circulating, and now in terms of regard to the 16 studies that Dr. Jack Turbin cited in the Arizona case, Arkansas case, in his declaration and to a judge, and it basically tears it apart.
Dr. Van Meter, we're going to have to leave it there. We're up against a break, but we'll continue that conversation another time. Always great to have you on.